Hey everyone, hope you're having a great week. Welcome back to Workout Wednesday, where we're going to talk about why you should keep exercising with back pain. A lot of people have back pain. It's a big problem in the United States of America today, probably across the world, but we don't deal with it appropriately. We have this mindset that we shouldn't do things if we're in pain, or we should avoid things if we're in pain, and that's not necessarily the case. There are red flags like numbness and tingling into your legs, pain shooting down into your legs, loss of bowel and bladder function. There's different things where you should go see your doctor, probably get an MRI, and potentially go see a neurosurgeon. But most people just have back pain or upper hip pain, like one or the other, maybe both sides. And that we need to move more, not less with. The problem is most people move less and it becomes chronic, then it becomes harder to get rid of. So how can we start moving more with pain? Well, we don't let pain be our guide. Pain's just a thing giving us information. It's like one piece of the information pie. It's not the whole pie. And we have to use that accordingly. We don't want it to be the sole focus. What that does is it makes most people focus on the symptom, which is the pain. So they isolate to this small area of the human body and they focus on that pain and they try to treat it right there where it's at. Unfortunately, the body's very complex. It's a biomechanical machine. It's got a lot of moving parts. You can have a foot injury causing muscle imbalances there that work their way up and end up causing back pain. You could have a core injury that's taking pressure off of one side and putting more on the other side that causes the back to hurt. So there's different biomechanical imbalances and neuromuscular inhibition that can occur throughout the body that can lead to low back pain. So if I was seeing you as an individual, I would do a full body assessment and we would find out the cause, not the symptom. I wouldn't really care much about the symptom. Okay, you have back pain. Let's find out what's causing that back pain and treat the cause. And a lot of times the symptoms go away. So sometimes I'm treating someone's ankle and knee and their back pain goes away because now they're stable on both sides and they're not overloading one side anymore. So we want to address the cause of the symptoms first and foremost. I can't see everyone that I'm talking to as an individual, so what can I provide that I do for myself that you could use in your own life? Well, we can do exercises that address the imbalances that most people have because most of society is here. We're moving front or moving back. You know, we sit here, we walk here, we move in this direction, we run, we bike, everything's linear, forward and backwards. So when we work out, we want to do things in multiple planes. We want to do things that are going to activate the hip and the core together, the foot and the shoulders together. Like everything's starting to move together so we get those neuromuscular inhibitions taken care of by refacilitating them to fire optimally. And there are some exercises that help to do that. So I'm going to attach a video to the back end of this with 4 to 5 exercises that you can use with your exercise routine, not as an exercise routine, because I want you to keep exercising. Just modify it so it's not increasing your pain, but you want to keep moving, you want to keep going. You don't want to avoid the things that you want to do just because you're hurting. You just want to either maybe do them a little bit less for a little while and slowly work back up, or just modify the weight, the intensity, the range of motion, and then slowly work back into those things. But we want to keep moving more, not less. So we're teaching our body to move the way we want it to and strengthening it into those movements. I used to tell patients that have back pain, don't bend, don't twist, don't do this. As long as you stay with a flat back and everything you do is like a robot, your back won't hurt. And that was correct, but unfortunately, real life happens. If you have a 2-year-old running up and falling off of a table, like I do frequently, then you're going to bend and twist. So instead of telling someone to avoid that, why not strengthen them into that? And so that's what I'm going to help you guys do, is learn how to strengthen your body into the ranges of motion that normal life requires so that you prevent your risk for injury or help that injury that you have start to feel better, because now you have muscles supporting your spine throughout that motion and your hips. So hopefully this helps. I hope to see everyone getting better and moving more and just enjoying their life that they want to live. Have a great day. Bye. Okay, so here we are. The first exercise I like to do, especially if I'm doing legs, but really I do this almost every time I work out, is just some deep squats. So what I do is I just spread my feet shoulder width apart. Some people call them yoga squats. And then you're just bringing that butt down as close to your heels as you can get it, and then standing up all the way. and then back down as close to your heels as you can get it, standing up all the way. Now, if you have an acute back injury, your first squats might look like this. That's okay. You got to start somewhere. You just move as much as you can without increased pain, and then the next week you might be down here. The next week you might be down here, and then eventually you can get all the way down and come all the way back up. Okay, so we want to keep that range of motion. Being able to hip hinge and go all the way down to the ground and grab stuff, bend down, is very important as we age. You know, it's tied closely to longevity, so we want to keep that motion the best we can. Now, I like step back lunges for back pain, because walking lunges, especially initially, you're putting a lot of like load on that spine when you land, but a step back lunge kind of takes that load away. So you can start off just step back, come up, switch. When that gets easy, you can step back and kind of rotate. It might not be all the way to start, but you can rotate, and then you can balance. And then you step back, go the other direction. Balance, step back, rotate. We're teaching those muscles to work together. Step back, rotate. Okay? With anything you can add weight. So with the squat, I can start loading that deep squat if I want to. Eventually, I can start loading that step back lunge with the twist to add strength, but not initially. Okay, we progress as our body tells us to. Now we want to get down on the floor a little bit. So we want to incorporate the core, the thoracic cavity, the abs, the low back, all of it working together. Shoulders, we're going to do what's called thread the needle. So we're just going to stick our arm through, look all the way up, look all the way up. All the way up this way. We're turning our neck as far as we can, following our hand, and then back the other way. We're all going to do that from a hands and knees position and from a plank position. So, same thing. You can put a dumbbell in your hand. Another exercise we're going to do from a plank position is called bird dog. So you're here, and then you're here. Flat back, straight arm, straight leg. And come down and switch. This, you want to keep your belly button pulled in like you're holding your pee. Like you just drink a gallon of water, and you can't go until you drive at least 4 or 5 hours. So you're really pulling that belly button in, hold your pee, and then reach. When that gets easy, we do it from a plank position. So we're in a plank position, and then we're bird dog. Okay? Switch. You can set up some resistance, either pulley or sports cord, grab it, and then pull that elbow to your knee. Another progression. Because what we talk about in one of our first videos, we talked about the law of reciprocal inhibition. So when I'm pulling these elbow and knee together, I'm contracting everything on this side of my body. That's going to tell everything on this side of my body to relax, which is very important, okay, especially if you have back pain. We want to be doing exercises that tell those muscles that are aggravated that, hey, it's okay to take a break, okay? And the best thing we want to do is really strengthen up the glutes with a good single leg squat routine, or bridge if you can't do the single leg squat yet. So we can one leg out and bridge it up. When that gets easy, you can add weight. You can put a dumbbell on your belly, just like this, and bridge up with that. Okay, you can hold it there, march back and forth. And this is going to really get the glutes strong and the low back muscles, but having a good strong glute, very important. Good strong hamstrings, very important to taking pressure off of that low back. Okay, If single leg bridges are hard, just do a double leg bridge initially. Just 2 legs. Bridge it up, hold it 10 seconds, and progress as tolerated. Okay, so if you'll start incorporating those exercises into your workouts, it'll help your low back start to get more flexible. And when it starts to get more flexible, you can do a little bit harder workouts like the next one I'm going to show you. You can start this without any weight at all. It's a staggered chop squat. So your left foot is a little bit behind your right foot or vice versa. And then you're going to reach to the outside of that back foot and then stand up and twist away. Reach to the outside of that back foot, stand up and twist away. Okay, when I'll show you the other direction. So right foot, a little bit behind my left foot, reach to the outside of that right foot, stand up, twist away. Reach to the outside of that right foot, stand up, twist away. That might look like this initially, and that's okay. Just like that. When you can do it without weight, 3 sets of 10, without increased pain, then you can grab some weight. I wouldn't start with the 25-pound kettlebell, but that's what I have. And you're just gonna stagger those feet, same thing. You're gonna let that weight drop to the outside, keeping your arms straight, stand up, twist away. Weight drops to the outside, stand up, twist away. Weight drops to the outside, stand up, twist away. Just like that. Okay, well hopefully we can start getting all these muscles in the core strong, start to get the spine moving again, and start to get you doing what you want to do on a daily basis. Have a great day. Bye.